Dear colleagues, hello. I am very glad to welcome you and thank you for this opportunity to speak before you. Today we will talk about the diagnosis and treatment of congenital eye anomalies in children. This topic itself is very extensive, very large, and clearly covers almost all syndromes and structures that make up the visual system. The brain's punishments before the editors, before the eye muscles, transparent media, and so on. All of this together constitutes the topic of our conversation today. Well, here is the statistics regarding this pediatric eye pathology. And it should be noted that congenital pathology leads to the emergence, in 16.7% of cases, blindness, and this is a very high percentage. That is, out of all congenital anomalies, almost 17% of children go blind. Well, here is a certain classification of congenital anomalies depending on location or various syndromes or manifestations. As you can see, the range, as I mentioned at the very beginning, is quite broad. Practically all structures are subject to one or another congenital anomalies. Now let's look at one of these manifestations, which is called anophthalmia, and see how it manifests. This is shown on the slide, right? Before you is an MRI for these conditions in this so-called MAC complex. This is a diagnosis that can be performed which detects the presence of anophthalmia. Before you is, first of all, an MRI ultrasound, which allows us to determine that this patient has anophthalmia. The MRI image is also before you. It is a rather severe condition. Thank God it is rarely encountered. What is it? Well, contrary to that, the history is that the formation of the facial skeleton is certainly disrupted in anophthalmia, and there are similar kinds of problems. Therefore, the treatment of this condition comes down to performing various cosmetic manipulations, such as thermoplastic surgeries and semiplastic surgeries, which lead to a good cosmetic result for the patient. Well, here is another complex, for example, microphthalmia. What does microphthalmia mean? This is when the corneal diameter is less than 10 millimeter and the length of the anterior and posterior axis is less than 20 millimeter. It should be noted that this is a rather conditional division. If, for example, the cornea is exactly 10 millimeters or 9.9 millimeters, such variants of the norm also exist, although they are rarely encountered. But there are cases, or the eye length is 19.8 millimeters. I have encountered such cases, but such eyes with microphthalmia are hardly worth calling that because they had good functions. Well, hypermetropic refraction, but the functions were quite preserved. Therefore, these boundaries here can be slightly shifted in one direction or another. Well, these are the diagnostic methods that allow us to identify this. In front of you on this slide, the types of diagnostics that we usually perform on patients under medication-induced sleep are shown. You can also conduct studies of visual evoked potentials in response to a flash, of course. Or, if the child is a bit older, then, of course, it is highly desirable to do it with chest patterns in order to also determine possible visual acuity of this patient before or the response of the cortex to, actually, objective vision. Well, that means this is cleaning cognate tomography. Now there are devices that allow doing optical cognate tomography, also under conditions of drug-induced sleep in children with appropriate sensors. Therefore, if such a device is available, it is also better to use it while performing diagnostics during sleep. Otherwise, if the child is older, it can be done. For example, from the age of 2, we usually manage to perform OCT on children and, in general, obtain information about the state of the fundus. MRI is a very important research method. In children with congenital pathology, we believe it must be performed in any case. And Of course, it is performed under sedation, so a corresponding anesthesiology service is needed, and it must be conducted in the presence of appropriate resuscitation services. Well, again, in cases of microphthalmia, we have a situation where everything depends on the severity of the pathological process and the severity of congenital damage. If there is any amblyopia, then, of course, we must treat the functional vision impairment very intensively, because this often allows for a significant increase in visual acuity, precisely because this functional component is removed. Well, of course, this is all done against the background of optical correction, like occlusions. Not just occlusions, there is also visual therapy, which allows us to treat all these conditions. Well, in principle, if there are also cosmetic aspects, for example, strabismus or other such issues, such as asymmetric eyelid fissures, then this means surgical treatment is needed. Well, coloboma, yes, coloboma is the third problem in this MAC complex, which is known to be related to the failure to close the eye cup during the second month, 1.5 months of pregnancy, 2 months of pregnancy. Then a certain failure occurs, and coloboma appears. Coloboma can be very varied. It can be complete, it can involve the optic nerve, and it can also involve the macular area. It often happens that when a patient has coloboma, and the optic nerve and macula are not affected, they can have very good vision. But there is such a cosmetic defect. However, there are cases when coloboma leads to very pronounced visual impairment. But here, of course, it all depends on how deep the process of the eye cup not closing is. We are now seeing coloboma of the optic nerve. This is a very characteristic situation. This is the picture you can see in this case. As you can see, the edges of the optic nerve disc are blurred. The course of the vessels is specific. The vessels seem to emerge from a completely atypical area, not from the center, but from the periphery, and at the same time, the course into the depth into this funnel is very noticeable. Well, again, here is what kind of diagnosis is conducted for these colobomas. MRI is very informative. Again, you can see in the MRI these specific defects, specific kinds of ruptures in the optic nerve itself. And this shows us that the optic nerve is not fully formed, and there is this coloboma. This is a rather rare pathology in front of you. This is a very rare type of coloboma, where the eyeball is almost not completely closed, and a cyst forms from the contents inside the eye, which all protrudes into such a cyst under the soft tissues, and in general, it is quite an unpleasant sight. Well, this is exactly this cyst. It is quite noticeable. As you can see, it protrudes from the eye into the soft tissues. This is the content. There is a cosmetic treatment story for coloboma. This is related to the use of contact lenses. As you understand, can also be surgically sutured if it is that large, and in principle, the surgeon is willing to do this. You can simply manage with contact lenses. Well, in general, that's probably all here. Nothing special can be done anymore. With these cysts and so on, depending on the severity, there is also surgical removal with subsequent plastic surgery. From megalophthalmia, unlike microphthalmia, is related to the fact that the cornea is very wide. This can be a consequence of ophthalmos. It may just be. Macrophthalmia, as you can see in this MRI on the left, is ophthalmos, and accordingly, axial myopia can also lead to such macrophthalmia. Congenital myopia can lead to this. By the way, high degrees of acquired myopia can also resemble a macroophthalmic picture. However, unlike true macrophthalmia, the cornea is usually normal. Well, here are various treatment options. If there is increased intraocular pressure, it needs to be lowered accordingly, surgically. Well, with axial myopias, it is necessary to monitor and treat amblyopia as early as possible to prevent its development in congenital myopia. Also, if there is a possibility of lens removal, with implantation for congenital cataracts, ectopia of the lenses, aphakia, these are also options for pathology, meaning anterior segment pathology. Here, diagnosing aphakia is quite easy. This is visible on MRI and on ultrasound, and during a regular examination in ophthalmological conditions under medication-induced sleep, it is also visible. The treatment involves, if possible, the implantation of an intraocular lens in case the structures are preserved, or the fixation of the intraocular lens to other tissues, if such an opportunity is not available due to the characteristics of this aphakic syndrome. Well, congenital ectopia refers to Marfan syndrome, the Marquardt syndrome, which is of congenital nature. And also, here the special surgery must be very delicate. Often, for example, if it is Marfan syndrome, it is associated with high myopia, with potential pathologies, intraoperative complications, detachment, and so on. Therefore, the surgery must be very delicate and very careful. The same applies to the fixation of the optical part of the lens, so that it is secured in case the surgeon decides to implant it. Well, this is about Marfan syndrome. Congenital cataracts are usually very diverse, nuclear, zonular, as you know, all sorts, and also require appropriate surgical treatment. And here it is very important to know one rule that should be considered by all pediatric ophthalmologists, and it is as follows. If the congenital cataract is unilateral, it should be operated on no later than 4 weeks from the moment of the patient's birth. No later, otherwise amblyopia begins to develop sharply, which is then very difficult to treat. Very difficult. If it is bilateral, then the surgery should be done no later than 8 weeks. And under no circumstances should surgical intervention be delayed. Today, there are many options with intraocular lenses that allow small children to undergo these surgeries, implant them, and ensure high visual acuity for life. Otherwise, we will potentially have incurable amblyopia developing. Here is the persisting hyperplastic vitreous body. As you can see, this is a picture related to the fact that the corresponding intrauterine structure does not resorb in the laser, and they remain like this, along with the arteries and other structures. Well, in congenital strabismus, it should be noted that every 452nd, 451st, if I remember correctly, child is always born with congenital strabismus in any population. So it is quite a common occurrence. Perhaps among all congenital anomalies, the most common is strabismus, specifically the comitant type. And here, as in the case of cataracts, it is important to know that the sooner surgery is performed, the better. It should not be postponed for the future, because amblyopia develops quickly. And most importantly, binocular functions do not develop, stereopsis does not develop, this ability to see does not develop. The ability for stereoscopic vision, and as a result, it is extremely difficult to restore this later. Well, in congenital strabismus, there are often vertical components as well, involving not only horizontal, but also vertical muscles. So, it is very important to approach this issue wisely, to correctly choose the extraocular muscle and the surgical treatment strategy, with the subsequent mandatory rehabilitation through vision therapy, which needs to be conducted. Here, I want to tell you about the innovations that we have today and that we apply, because we were both developers and co-developers of these systems. And this gives us the opportunity to operate very precisely. This is the Mathematical modeling of the operation itself, where not only the angles of strabismus are taken into account, but also the individual parameters of the patient's eyes and their mathematical interdependence, which allows us to perform this operation very precisely and have an accuracy of plus or minus 5 degrees from the Lecce calculated value. This is the highest accuracy that exists in the world today. In addition, we perform a special operation that is minimally invasive, which allows us to use a radio wave knife instead of scissors and other cutting instruments. The operation is delicate, bloodless, which allows for quick healing. On the same day, we open the patient's eyes. On the same day, they can read, write, watch TV, play on the computer, anything on the day of the operation. This is such, in addition, minimally traumatic surgery itself. It enhances the accuracy of our calculations. That is, it brings the calculations closer to what we actually achieve after the operation, because not many adhesions are formed, and various scars that interfere and also affect the result of the operation do not form. These are cases of various congenital strabismus before and after the operation, as you can see. How else can we help children with eye movement apparatus pathology? Surgery is not for nystagmus if the child has nystagmus, and effectively Andy developed system of surgical intervention for nystagmus. Vision therapy is a very good method of rehabilitation before and after surgery to improve visual acuity and restore binocular functions, as well as in the case of progressive myopia, an event that also contributes to its stabilization. Not only contact lenses, not only glasses or other lenses, but a systematic approach to stabilizing myopia allows us to stop it precisely through a system that is also part of vision therapy. Treatment of amblyopia in children, which is a consequence of almost all congenital anomalies lead to some degree of amblyopia development one way or another. Therefore, the use of vision therapy for the treatment of amblyopia and the improvement of visual acuity in such a patient population is also indicated. Well, what are our main rules? What does it mean to rehabilitate a patient with strabismus in our understanding? This is to achieve symmetrical eye position, high visual acuity, and stereoscopic binocular visual perception. Various methods and systems are used in conducting vision therapy. Different techniques, as you can see. Well, that's probably all for now, friends. Thank you very much for your attention. I would be glad if we could have some feedback from you. I hope our organizers will somehow arrange for us an evening of questions and answers. You will all gather, and we will indeed all be able to have a conversation about this lecture and also other lectures that we are organizing. Good luck to everyone. Take care. All the best.